So the pharmacological actions of these antimalarial drugs, which are similar to chloroquine, which pharmacological action is almost similar to chloroquine. So their pharmacological action is like this way: antimalarial activity, other parasitic infections, and other actions. Now, the pharmacokinetics. So you have to just read this chloroquine totally, so you can answer all the other drugs. Here, the mechanism of action of quinine is similar to chloroquine. Then the pharmacological actions like this way: the antimalarial action, erythrocytic forms of all malarial parasites, including resistant falciparum strains also. So the antimalarial actions of this quinine, that means it acts erythrocytic forms of all malarial parasites like Plasmodium vivax, Plasmodium ovale, Plasmodium malari, and including resistant falciparum strains also. Gematocidal for vivax and Plasmodium vivax and Plasmodium malari. It has a local irritant effect, local pain, sterile abscess, then cardiovascular, depresses myocardium, lowering excitability, lowering conductivity, increased refractory period, profound hypotension, intravascular, and its miscellaneous actions are mild. It has mild analgesic action, antipyretic activity, that antipyretic which reduces the temperature, body temperature, stimulation of uterine smooth muscles, then curaremetic mimetic effects, etc. It has some adverse drug reactions like tinnitus, nausea, vomiting, headache, mental confusion, vertigo, difficulty in hearing, visual disturbances, diarrhea. These are all the adverse drug reactions of the quinine, which we can get from cinchona bark. Then idiosyncrasy, cardiovascular toxicity, hypoglycemia, these are all the adverse drug reactions. Now comes to the uses. It is used in case of malaria. It is uncomplicated resistance falciparum malaria, cerebral malaria. We can use this quinine. Then myotonia congenita. Myotonia congenita, the doses of this quinine is 300 to 600 mg BD twice a day, and TDS thrice a day, and nocturnal muscles cramps, for nocturnal muscles cramps 200 to 300 mg before sleeping. Then spermicidal in vaginal cramps, varicose veins along with urethane causes thrombosis and fibrosis of varicose vein mass. Now comes to primaquine. The mechanism of action of primaquine is it converted to electrophiles, then generates a reactive oxygen species which interfere with oxygen transport system. So primaquine converted to electrophiles, which generates reactive oxygen species. It's converted to electrophiles, which generates the reactive oxygen species, and which interferes with oxygen transport system. Now comes to antimalarial action. Antimalarial action of primaquine, liver hypnozoids, weak action against erythrocytic stages of Plasmodium vivax. So used with suppressive in radical cure, and no action against erythrocytic stage of Plasmodium falciparum. It has a gematocidal action, and it is the most effective antimalarial to prevent transmission disease against all four species like Plasmodium vivax, Plasmodium malari, Plasmodium falciparum. and Plasmodium ovale.